Hi, everyone. I'm Kirsten Potter, and I'd like to start by thanking Heather Hayes for the opportunity to present our research poster for the Stroke Special Interest Group. I'm happy to be representing my collaborators who worked with me on this project on the use of the core set outcome measures in acute care versus inpatient-outpatient neurologic rehabilitation. As you likely know, a clinical practice guideline on a core set of measures was published in the Journal of Neurologic Physical Therapy in 2018. Based on a thorough review of the literature on measures of gait, balance, and transfers, Moore et al. Recommended 6 measures for use in adults with neurologic conditions with the goal of standardizing care across patients and settings. The 6 measures include the Berg Balance Scale, the Functional Gait Assessment, the Activity-Specific Balance Confidence Scale, 10-meter walk test, 6-minute walk test, and 5 times sit to stand. This project served as phase 2 of a knowledge translation study to examine the knowledge and confidence of PT and PTA clinicians across a healthcare system with 7 sites. Specifically, we aim to determine the use of the 6 core set measures in inpatient and outpatient rehabilitation, PT and PTA knowledge and confidence of the core set CPG and the measures, and the use of their measures in practice. We also explored barriers to using the core set measures in this healthcare system. To do so, we used an online survey that was distributed to all PT clinicians as well as their administrators. The data I'm presenting today is from the clinicians only. We compared our data from the inpatient and outpatient clinicians to other data collected at an earlier phase of the study, where we administered the same survey to PTs and PTAs treating adults with neurologic conditions in the acute care setting. In doing so, we aim to assess for differences in the use of the core set measures between these settings. We also wanted to explore barriers for use of the measures across these settings so that we can target specific strategies to enhance adoption and implementation in various settings across the healthcare system. As you can see on the top right side of the slide, we had 47 respondents. Most were PTs and slightly more were acute care therapists as compared to inpatient, outpatient clinicians who participated in our survey. For both groups, few had read the CPG, and collectively, 38% reported that using the entire core set was useful in their practice. However, it can be seen on the bar graph that many therapists use the Berg Balance Scale and 5 times sit to stand in both inpatient, outpatient, and acute settings. Approximately 60 and 80% of inpatient and outpatient therapists also use the functional gait assessment and 6-minute walk test, respectively. However, far fewer therapists in both settings use both the ABC and the 10-meter walk test. For both respondent groups, time was a major barrier to using the core set measures. Both measure administration time and limited overall treatment time were identified as barriers. 56% of inpatient and outpatient respondents noted that the core set measures weren't appropriate for their patients. A couple of other interesting findings were that 43% of the acute care therapists reported that they lacked sufficient knowledge to complete all measures, and some in both settings report lack of knowledge in interpreting measure results and using the information to inform treatment. Given our results, it seems clear that there were a lot of similarities, but also some differences in core set measure use and barriers to using these measures between inpatient, outpatient, and acute care therapists. Our next steps are to further analyze our data, as this represents only a segment of our survey questions. We'll be using the data to work collaboratively with the PT clinicians and administrators across this health system to enhance adoption of the core set measures. Thanks again for your interest in our research and poster. If you have any questions, please feel free to reach out to me at kirsten.potter@rockhurst.edu.